doctor by the name of Marshall Lewis. And he is from Lincoln Hospital, you know? And he was so profound. We had such a good time listening to him talk about it. I asked, could he find somebody to come and speak to us about breast cancer and prostate cancer? Two other things that are hitting our community that, again, as she was saying, we need to talk to our doctors about. And I was concerned about that because I had to go through that. And I said, we need to know what that was all about. Women, it's very serious for us and for us to take care of our bodies. So today, please give a round of applause for our Dr. Jackson coming from the
Good afternoon, everybody. Thank you for inviting me. Let me tell you a little bit about myself. I'm Dr. Tranice Jackson. I'm actually a lifelong New Yorker. I've only lived out in New York for 4 years, but I went to college at Brown University. I went to Downstate Medical Center for medical school and did my residency at Courtlandt Hospital. I've always worked within the city health system. I worked before coming to Lincoln, actually worked at private sector. So I've taken care of our people in all different places. I've always worked in what they're called safety net hospitals, where we take care of everyone regardless of the doctor's pay. So my current position is I'm the director of the primary care clinic at Lincoln Hospital. I'm also a primary care physician. I do want to echo how important it is to see a primary care physician because we actually beg our patients to come and see us literally sometimes, despite having some very significant health issues. I know life is complicated for a lot of people, and we do understand that. But your health must always be paramount, because if you're unhealthy, you can't take care of others. So I know particularly when we want to be supergirls and take care of everybody and everything, put yourself on that list. Don't put yourself number 10. Put yourself number 1, because your health is paramount and the most important thing for you to guard, because that's the only way you can take care of all the people that we take care of. So breast cancer. Breast cancer, we've actually made a lot of strides in breast cancer and treatment of breast cancer. But the most important factor is we diagnose it early. And diagnosing it early is the most important thing. So we start screening mammograms at the age of 40 because Black and brown people tend to have breast cancer that starts a little bit earlier. And then we follow it every 1 to 2 years based on what we find. So really, when you hit the age of 40, you should be asking your doctor for the first mammogram. Yes, your doctor should be offering it, but unfortunately, we get busy, we get distracted, and sometimes you have to bring us back. Hey, doc, I'm here to see you. Am I getting my mammogram? What other tests should I be getting? So also, your involvement also helps guide your care. So, the primary way we screen for breast cancer is with the mammogram. We also do breast exams. We also do, and I'm sure you've heard about self-breast exams at home. Why is that important? Is one, you know what your breast feel like. So if you know what your breast feel like, because sometimes people have lumpy breasts, some people's breasts are smooth, but you get an idea of what your breasts feel like. So when you start feeling that it's different, then that's the moment you definitely need to not wait and go see your doctor. So when you're starting with home breast exam, and there's different things people say. It's like, oh, if you don't know what you're feeling, you shouldn't do it. So if you do it, you get lumpy breasts, you go see your doctor. Hey, my breasts are lumpy, and you check. So then they can tell you, you know what, this is normal for you, so that you have an idea of what your breasts feel like. And another important thing is you do it around the same time of the month. Why? Because our breasts change, particularly if we have our menstrual cycles. So they're tender, they're a little bit more engorged when we have our menstrual cycle. So they're going to feel different than when we don't have our period. So those are also important things to do around the same time every month. You feel something abnormal, go talk to your doctor. He's the person that can help comfort you. So if we do a mammogram, sometimes we may see doctor tells you that your breasts are, that you have a BI-RAD 0, you need more tests. I tell patients, don't get upset yet. It's just that we're making sure your breasts are okay. So we do additional tests. Another thing that comes up a lot is what's called dense breast. Dense breast basically means the tissue of the breast is very thick. I tell people they stand the test of time, so they don't stand. However, and I know women know exactly what I mean. However, it is a little bit more difficult to find small cancers in dense breasts, which is why the doctor tells you your breasts are dense, that they'll often order what they call it, we do an ultrasound, which is a second view of the breast, and then make sure you do your mammograms every year, because it's less likely for you to feel anything when you're palpating, and the only other way we can really look at your breast are through the images. Now, a lot of women complain that it hurts, and yes, it is uncomfortable, because they do kind of have to smash your breast down in order to get a good picture. But that discomfort is well worth it, because if we find something early, we can then do something about it. So that is definitely something that is worth a little bit of discomfort. So, like I said, let me just make sure I have everything covered. Okay, so if there's a lot of different cancers in your family, ask your doctor whether you should do genetic screening. Particularly if you've had siblings or grandparents, aunts, uncles who've had breast cancer, then you should definitely ask them, should I be screened? Because we have noted that there are some genes that increase somebody's risk for breast cancer. So that's information that you could use to determine, because some people have had prophylactic breast removal because they are at high risk for breast cancer. Or if you're at high risk, then we can surveillance you differently. So even if there's a lot of different cancers in your family, ask your doctor, should I do genetic testing? There's actually a syndrome called Lynch syndrome, where there's a lot of different genetic predisposition for many different types of cancers. So even if it's 5 different cancers in your family, ask your doctor, should I be tested for Lynch disease? So, and it's really important because, I know no one's heard of Lynch disease. L-Y-N-C-H, yeah. Yeah, it's actually Lynch syndrome. Because so if you have different cancers in your family, then think about, should I be tested for Lynch disease? And I know a lot of times because, one of the things, the pressures they have in the amount of time a physician can spend with a patient, being prepared and thinking about what you want to talk about is critically important. Because you help guide me, because I have my agenda, but I need to know your agenda. So that's important when you're seeing your physician. So if you don't mention to me that, I have someone with breast cancer, someone had lung cancer, someone had pancreas cancer, should I think about that, doc? If I don't know that information, then I you know, we primary care physicians, we don't know everything, okay, and there's a lot. So I have a geneticist. If a patient presents, you know, that they've had multiple different cancers, I send them to my geneticist. The geneticist makes the decision on whether it's worth testing, because they'll map it out and they know all the different things about genes. Because I can tell you, I don't know which gene that does what. No, that's too much for my little head. So, so I send it to the geneticist. So you can just simply ask, well, I want to refer to geneticists to talk to them, and then they can make that determination. Some of the geneticists will tell them no, and some of them will say yes, we need to test it just to make. And even it's also information for research. You know, even though, you know, it may not be clear, they'll do it anyway, because it actually helps build our body of information that we have. So then we can just correlate things, and if we see, oh, well, this gene, 45 people's parents had X cancer, they can say, well, that's a gene we might be concerned about. So it actually is information. It's the most, and that's how we learn in medicine, is by information. So, you know, there's nothing wrong with saying, well, let me discuss it with a geneticist, because they're a specialist, I'm not. You know, I actually had a case the other day. A patient requested genetic testing. I took their information, I sent it to my geneticist, and he said, I want to see the picture. So, you know, don't always let us sometimes block things down and say, no, you know, I'd let you talk to the specialist about it. Any other questions? Yes.
Good afternoon, everyone. I was just diagnosed a couple of weeks back with breast cancer, and they found it in the right side of my breast, and how it stayed hidden. They found a spot, but where they found that it was in the nipple part, and it was like in the milky. But they didn't find it until they had to go in twice. They had to go into it twice. And it was like milk. And like they were saying, sometimes you can't find it. They gave you twice to mammogram.
Right.
Then they had to do decision to find out. But like the doctor was telling them, they had to talk to 2 other doctors to make the decision of what it was going to be like. Either they're going to have to go in, or either they're going to decide to give me the pill that I wish I could take for the rest of my life.
Right. Yeah.
So, you know, just as you were saying, there's so many ways that they have to do it for the breast cancer. You know, so now it's either milk they got to draw out or go in, or either it's the pill that decide.
Yeah, breasts are very complicated. They are extremely complicated. And that's why following up with your results is also important. And, you know, many patients were doing studies 2 and 3 times a year, just trying to figure out, is that spot something we need to worry about, or it is just a spot? So it really just shows you how complicated it is, and how much work sometimes it takes to figure out, is the patient healthy, or are they not? Okay, so now let's swing over to prostate cancer. So getting a man in to see me sometimes is one of those. Yes, ma'am.
Hi, so I'm a breast cancer survivor 10 years now, and they also found it in my milk, and then when they took out the tumor, and then they said I did have LIC, and I was able to take the pills, and I did get the genetic testing. But does that genetic testing last for a lifetime, or should I still keep going back, because they said that it can also spread to the left breast? But I'm 10 years cancer free, so should I just keep on? I thank God for that. I stand on my faith, and my journey has been really, I'm just grateful to God. And I walk all the time for cancer. But I just wanted to know, besides me taking the mammograms every 6 months to a year, should I still do the genetic testing 10 years later?
No, you only need to do it once, and actually it's also information for your family. So that's the most important why you do the genetic testing, is that you can alert your family as to, hey, I tested out this, genetic test said there might be a predisposition, then please go get genetic testing. So only once you need to get genetic test. So getting men into CV is probably a lot more difficult than anything. And many of them are working, and then, so I'll say it's because they're working so hard. But I think men and their health is one of the biggest crises in our community, because getting them to take their health as seriously as they should is an issue. So, for, hypertension, diabetes, it runs in our communities. So it's really important that everybody gets screened for diabetes and hypertension. So prostate cancer is one of those, is a little bit, we'll say, in the gray zone. Because if you read about prostate cancer screening, you'll hear different things from different groups. I'm in favor of prostate cancer screening. I screen all my men for prostate cancer. And I actually start at the age of 30. Why do I do that? Is that we screen you with a test that's called the PSA. The PSA is a chemical that's produced by the prostate, and it varies widely in different people. So I do one young, so I kind of know what their baseline is. So I know exactly, as time goes on, if it changes, that maybe I need to send them to the urologist. Now, the PSA is specific for the prostate, but not specific for prostate cancer. So this is where if you have a prostatitis, which is inflammation of the prostate, if you have a large prostate, you can have an elevated PSA. So it's not like a black and white test. However, I think it's still worth doing regardless, because when it is discovered late, it is very difficult to treat. It metastasizes it spreads to the bone a lot, and really once it's spread to the bone, it's very, very difficult to control. So another way they do the breast is what we call a DRE, which is a digital rectal exam. So it can pick up prostate cancer if it's pretty advanced. So usually by that, they always tell us when we do a prostate exam, it's to feel like the tip of my nose. If it's hard, it usually means that there's something wrong with it. But it's a pretty much more non-specific test, because you can also find it a little bit firm with prostatitis, which is inflammation. So really, to me, the best test is the blood test. So once the blood test comes back positive, then we usually send you to a urologist who will discuss with you the next step. So usually the next step is some biopsies. So that way they can see whether or not they find any cancer. So it's an uncomfortable procedure. I'm not going to tell you guys that it's not. It's a little bit uncomfortable, but it's important to do because it'll determine whether that elevated PSA is due to just inflammation and a big prostate or due to prostate cancer. There are various ways to treat prostate cancer once you have it. There's chemotherapy, there's radiation therapy, so there's a different way. I know on TV they talk about, the cyber knife. So there's a lot of different ways to treat it where it doesn't affect your erectile function as much. And I know that's a concern for many men. But it's really important to get that screening done early. And then whatever the results are, to follow up on it. So it's, I just find in general, I reach out to my men to get them in far more than I reach out to my women, which is great that the women come in. But you guys have a vital role in our lives, and we want you there in our lives, and we want you there healthy in our lives. So I think that's very important to get encouraged to come early, to come and do your screening. And, with prostate cancer screening, it doesn't have to actually be done every year, because if your level is very, very low, we check it every 3 to 5 years, because the one good thing about it is a very extremely slow growing cancer until it starts to get big, and then that's when it begins to grow fast. So we have a baseline for you. We don't bother you every year, but at least every 3 to 5 years we're going to recheck it. And of course, if at any point you have complaints, what complaints are we talking about? You find out suddenly you urinate frequently. You find that your urine stream is not as strong. You dribble at the end. All of that tells us that there could be something wrong with your prostate. So those are reasons for you to come in and have yourself be checked by your doctor. Could be just simply prostatitis, which is just an inflammation, but it also can be due to prostate cancer. So if you suddenly start having symptoms, including erectile dysfunction, you start having that, those are all reasons to come in and see your physician so you can get screened and care provided. You know, erectile dysfunction is a lot of different things cause it. Diabetes and hypertension. Those two should be included when you're coming to your physician and complaining about your change in erectile function. So there's a lot of things that we can look at when you come and see us. So I can't encourage you guys enough to really utilize your PCP. And sometimes I'll say you got to be a little forceful with them. Well, doc, no, I want this done today, and why can't I have it done today? So that they understand that it's important to you. Guarding your health is a two-person job. I do one part, but you have to do another part. And sometimes, you know, as you said, write things down. That's actually the most important thing, is what do you want to discuss with your doctor so that he knows what's on your mind and we can take care of what your issues are. Because we know what's on ours. Well, you know, I'm going to take care of your diabetes, your hypertension, all of that. But these other things coming on. You know, when you spoke about multiple myeloma, it's actually detected possibility with routine blood tests. It's routine blood tests. It's not anything fancy. You know, routine blood tests every year can help detect something that's going on. So that's why it's important for you to go see your doctor. It's like, hey, I'm here. I want to check my kidneys. I want to check my liver. I want to check my cholesterol. I want to check my CBC. Those are basic tests that we normally do. And actually, it gives us hints for so many things. So that's why it's important that you ask for these tests. Because sometimes, if you feel good, like, oh, you feel good, that's fine. That's all well and good. But sometimes we need to make sure everything looks good as well as you feel. So that's the important thing about really utilizing that time with your physician well. You know, the more you guide us actually helps us. Yeah, because I don't live in your body. And if you suddenly start saying, you know what, I'm hurting all the time, we need to then take a look as to why you're hurting. Yeah, so don't be afraid to talk to your doctor. That's what we're here for. We have to listen to you and make sure we're satisfying what you also need, as well as looking at our agenda of what we know is going on with you. But it helps us find what else is going on. So, pretty much, I mean, just in general, you know, there is no way to totally prevent cancer, but the healthier you live, the better. That's it. The healthier you live, the better. You know, I know we love our fried chicken and we love all that great food, but we really have to look at our diets because there has been some links between unhealthy diets and some incidences of cancer. So, you know, we can all have one special day, but we don't need 7 special days. So cutting back. So I actually share with my patients, and I'll share with you, is that I lost about 25 pounds. So what did I do? I really wanted to show that sometimes simple things can be done. So a couple things I did is, number one, I stopped unhealthy snacking. So if I want to snack, it's a fruit, it's a nut. There's nothing else I snack on anymore. I don't snack on anything unhealthy. I got rid of all soup drinks. I don't drink water. What I did is I moved my major meal from dinner to lunch because eating a heavy meal and going to bed, I'm not burning any fuel. But if I eat it at lunchtime, I'm burning fuel. And then I started making sure I walk between 4,000 and 10,000 steps every day. So they always see me speeding around the clinic. It's like, because every day I'm counting my steps. I now have 1,333. So I'm on the low side for today, so I have to make it up later on. So, and those a lifestyle. And that's really about do something that you can stick to. You know, it's very easy to say, let's diet for, 6-8 weeks, you lose 10 pounds, you party while you're going out and eating your big bowl of mac and cheese. And then you go back to your old eating habits. What happens? Your weight comes back. So you're really into just changing your lifestyle. Don't diet, change your lifestyle. So what I do is, though, every Saturday, I do reward myself. I think my meal today is I'm going to a Mexican restaurant. So I allow myself a meal of what I want to eat. So I always tell people is that every day can't be Christmas. So think about that with your diet. Every day can't be whatever I want to eat. So the second step, because I want to now lose another 15 pounds. So what I do now is what I call is I simplify my meals. So what I do is I no longer ask myself what I want to eat. Because when I ask myself what I want to eat, I want the bacon, with the home fries, and the cheese omelet. That's what I want to eat. But what I did is simplify myself. So for my normal breakfast during the week, I do Greek yogurt with fruit, nuts, and honey. And I do that every day. Because at the moment I start thinking about it, I look for something else. So I also have a few groups of similar calories. I may do 2 boiled eggs with a fresh toast, but I have the same simple meals every day. So that has made meal planning easy for me. And that also helps you stick to your diet, your one word, lifestyle change. So the less you have to think about what you have to do every day, you just get up the road and do it. It makes it very, very easy for you to make these lifestyle changes. So, definitely for unhealthy lifestyles, that definitely removes cancer. So changing how we do things in our life is one way to help prevent. Minimize alcohol, because neither of them give us any benefit. And exercise. And like I said, start simple, just walking. Keep your little pedometer. 4 to 10,000 steps has been shown to have a health benefit. And just keep it going, and the more you do, the better you do. And like I said, you start getting used to it. So I'm used to my yogurt, honey, fruit in the morning. It was funny because I went on vacation and they didn't have that there. And it was like I kept walking around, what am I going to eat? Because I've gotten so used to that healthy eating that I didn't really want anything else. So you really can change yourself and do it slowly so that you can keep it. It's not a race. You can get it done. And you'll find you start feeling better. And that's the most important thing. Does anybody have any questions? Yes, sir.
Hi, Doc. Thank you for presenting. I had a question. It was back when you were talking about breast cancer, but I had to go downstairs. Like 10 years ago, I had heard some concern about men getting breast cancer, but it seemed like it's quieted down. Well, how would a man get tested, or do you just actually provide, or?
It usually starts with part of your physical exam. Yes, men can get breast cancer. Yes, they most certainly can. So really part of your annual physical should be asking your doctor, just check to make sure there's no lumps. Or even you, when you're examining yourself, if you start feeling a little lump, men should not have any lumps in the little bit of breast tissue that they have. Yeah, you should not have any lumps. So if you feel a lump, then you definitely need to come and see your doctor. So yes, even a tiny bit of breast tissue can cause breast cancer.
Thank you.
Yeah. Yep, everybody's got breasts. Any other questions? Okay, thank you for having me.
I don't know about you, but I'm feeling pretty good, y'all.
Yeah.
I'm gallon